Hello, good afternoon, I'm back. I'm your host, Dr. Festus Ossai, the National Coordinator of the Medical Ultrasound Forum. Today we want to talk about a very controversial topic in ultrasound scan, in obstetric ultrasound scan. And what is that topic? Fetal gender assessment and identification in ultrasound scan. It's a very controversial issue. Some don't want to talk about it, some don't want to look at it, some want to say there's no need. Why? So in some certain hospitals or facilities, it's a policy that you shouldn't tell the gender of the baby to the patient. Well, I don't blame them. Mistakes can easily happen if you don't follow the certain concept. Now, the accuracy of the fetal gender, how reliable it is in ultrasound scan. It is as reliable as the features you see is as reliable as you looking at the baby at delivery. You look at the penis, you say it's a male. You look at the labia, you say it's a female. It's as simple as that as well in ultrasound scan. Now, at what gestational age are we expected to accurately identify the genitals? At what age? Well, you can have age from 4 weeks down to 40 weeks. But at what age you think is accurately? You can also see it at 12 weeks. But as the pregnancy improves in size and based on your specialty or expertise, you can see them as quickly as possible. Now, even when you are good in scan, sometimes you will not see the genitals. The baby will just close the bum, close the legs, and you don't see nothing. So just know that it's not in a situation you will pick the genitals in scan. Do not be heroic. Okay. Well, what are the factors that determine one's ability to get the fetus genitals, gender in scan? Before this, let me have a special announcement. And what's the announcement? The Lagos Executive Ultrasound Scan Training Workshop, slated for November 29th to 3rd of December 2022, has been shifted to January 24th to 28th, 2023. And based on that, we had another meeting again. We had to change the logistics in terms of the registration. You know, initially we were thinking that, okay, let's continue the late births, but for some certain reasons, we said, okay, let's go back to our initial arrangement. So the early births has not come back again. It's going to be from November 26th to January 17th, 2023. Then the late births will now be from 18th January to January 23rd, 2023. Then the venue at the venue is 300,000. Look at the cost is already stated here. So try and register early so that we can plan well for you, get your materials ready. We just want to make sure that as soon as you come for the training workshop, all your materials are ready. So the ones we are giving you, we are following through, and it makes it easy. Because we have 5 days to achieve maximum what you want to achieve at that point in time. Of course, there are CPD points and other things that you get. The venue and the rest remains the same. Okay. You know, we talked about topics, very good topics that are not common in ultrasound training workshops. Thyroid scan, breast scan, scrotal scan, talk about transvaginal ultrasound, transrectal ultrasound, and all these sonometries and the rest. These are not too common training workshops. So we want to bring them to bear. I want to show you some certain secrets and things that you're going to learn about this ultrasound scan. You'll be happy you did. Just try and make a day. Try and come around, you'll be happy you did. Okay? Now, we'll talk about the fetal genital, how to identify the genital. There are some factors that will determine whether you can get the genital of the fetus or not. And what are the factors? One is the gestational age of the fetus. Yes, in very early, some people come to you 6 weeks, say want to do genitals. How do you see the genitals at 6 weeks? You don't see it at 6 weeks. Although the same age you get to, we're going to show you later on that you can get the genital, and the same appearance you see, we're going to get the genitals as well. Then talk about amniotic fluid volume. In case of severe oligohydramnios, you might not see the genitals. But when you have a good amniotic fluid volume, you cannot see the genital. What I'm saying is that, so that when you have a case of severe oligohydramnios, and they say, please, I want to know the sex, don't bother looking for it. You won't see it. You won't see the genital. Okay? And talk about anatomical window. Yes. If you have a poor tissue fluid interface, you may not get the genitals. But if you have a good one, you get the genital. Fetal lie. It is easier to pick the genitals when the baby is lying longitudinal or oblique than when the baby is lying what? Transverse. Take note. Transverse lie is difficult to get the genitals in scan because the baby is flexed over that area, so you won't see much you want to see. Then presentation, it is easier with cephalic presentation. Down in bridge presentation, fetal movements, no movement or extra movements will give you difficulty in picking up the genitals in scan. Then the posture of the baby, if the baby is flexed, hyperflexed, you won't see the genitals in scan. It's very difficult for you to pick genitals in scan. There are scanning techniques. What are the techniques you are using to pick up the genitals? If you have a faulty technique, of course, you will not get the genitals in scan. Resolution of the machine, good resolution, good ability to pick up the genitals. Then level of experience and expertise. Then of course maternal intraabdominal fat. People that are very bulky with a lot of maternal fats, you may have it difficult to identify the genital because the brightness of the image you see will be poor, so you will not be see clearly. Now some will say, okay, look, now these are some examples of genital. Oh, it's a female. Oh, it's a female. Now you look at this. Why do you think it's a female? Why is this view coming up so clearly? How can I make it in such a way that I can easily identify it? I'm going to show you. Now, this is what the hamburger sign. Oh, it's a female. Now this is a male. Oh, it's a male. Now this is a boy arrow side. Oh, it's a male. This is a tortoise side. Oh, it's a male, and so on and so on and so forth. The question: how do you bring up these images? What are the things you need to do to bring out these images in scan? How do you identify the different gender at different age? That will talk about the principles that you need to identify the ultrasound scan. I have about 7 principles I was able to derive that will help you out. One is identifying the ultrasonographic anatomy of the genitals for the different sex at different gestational age. At different gestational age, there's a certain appearance you expect to see of the genitals. That's why you see some people get genitals at 13 weeks, you'll be surprised. How did you get it? Of course, there's a certain level of appearance you expect to see at that gestational age as compared to the older pregnancy. Then identifying the ultrasonographic anatomy of the male and female genital at different anatomical planes. Sometimes you may not be privileged to see the genital in whole view, but just a part of it. So if you understand how you can do that, then of course you'll be able to identify the genitals. Then identify the appropriate position or location. Look out for genitals while scanning. Then scanning our navigational techniques involved in locating the groin area. See, don't scan the baby and think you can get the genitals at the wrong place. If this is the fetus right here, can you see that? You're looking at the genitals at this point, not at this point. A baby will put the finger this way, and you see just two fingers on the baby and say it's a female genital. No. So you need to know the appropriate location to look out for the genitals in scan. Then the next one is relevant anatomical landmarks. What are relevant anatomical landmarks you need to know? The distal spine of the baby, the lumbar, the lumbosacral area, of course, the proximal distal femur, the urinary bladder. These are the landmarks that you need. They talk about the maneuvers in creating the anatomical windows. Then take note of the male and female genital differential. Yes, do you know we have differentials for the male and female genitals? Take, for example, now, the cause of umbilical cord may be at the groin region. You think it's the scrotum, it becomes a differential. Take another example again. You may be scanning, because the 2 fingers of the baby at the head region, you think is the labia. And so I'm going to show you some certain differential, and it will shock you to know that these things are real and these are possible. And that's why you can beat your hand and chest and say, oh, I've got it, I saw the labia, how come it's a male? You made the mistake. That's just trick. You made the mistake. Well, I want to say a very big thank you to all of you for your understanding. On behalf of my team, I would want to say today thank you to all of you for understanding, for being with us all through the while. A very big thank you. May God bless you all. If you have inquiries, please be free to call these numbers at any point in time. You can SMS or WhatsApp us. Thank you. Please share your videos and your pictures to us so that we can review them and tell exactly how you are doing. Thank you very much and God bless.